in less than 2 weeks, the city of Spokane is launching some changes to its response to homelessness. KREM 2 Shannon Mowdy previews what those changes you'll see next month.
It's in with the new for Spokane's homelessness response initiative. New outreach teams will soon hit the street to connect the unhoused with housing, services, or get them into emergency shelter.
We've heard quite a bit from the community that when they see somebody who's maybe in a mental health situation, it's not really a 911 call, it's not life-threatening, but they don't really know who to call.
Aaron Hutt says under this new model, the public will be able to call 311 about these situations. Teams of Catholic Charities social workers will also coordinate responses with Spokane Police and the city's code enforcement.
So if police see somebody, they'll be able to help dispatch this team out to get to those folks. We don't always need our police officers tied up in that response when potentially a social worker is the right person to respond.
The street outreach will cover police precincts in every corner of the city, working 7 days a week. The city's other outreach effort will be more of an out with the old model. Another change is coming to the former Cannon Street shelter, which has provided 30 overnight beds for the last year. Now this navigation center will close during the evenings.
It's really going to just serve as a daytime facility. We hear so often that we just don't have places for people to go during the day.
Hutt says the change in hours does mean the Cannon Street site will no longer provide shelter beds. But she says this transition is backed by the city's own data.
There's a bit of an obsession about bed space. An emergency shelter absolutely has a place in the system, but we see about a 13% success rate in exiting people from emergency shelter into stability. Our navigation center has about a 45% success rate.
And Hutt adds the city's seeing empty beds at many of its shelters. Under the new hours, the navigation center will be able to provide services to around 80 people.
What we need is a place for people to be able to connect with those resources, that treatment, that mental health treatment, housing vouchers.
Both new initiatives are expected to roll out in early October. Shannon Mowdy, KREM 2 News.